Here at the Joint Orthopaedic Centre, we have a well-established process to prepare patients for the surgery, minimise anxiety and optimise their cooperation. It's not something that we do to patients. The surgical process is something that we do together. So the education process is aimed at harnessing the patient's cooperation, harnessing their understanding, so they can help us get them through the process as quickly and as effectively and as painlessly as possible. So we have a consultation where we discuss the underlying problem, the treatment options, and the process for progressing. And the patients have time to think about what we've discussed. Often they come back with a relative and we have another discussion and address the questions they may have. Then, if the surgical option is adopted, the next step is to have a formal consultation with the anaesthetist. And often patients are more concerned about the anaesthesia than they are about the surgery. And so the fear of the anaesthetic is something we address before the surgery. And my anaesthetist, Dr. Dennis Kerr, carries out formal consultations in my office with the patients and their relatives to make sure that their concerns are addressed, that their fears are minimised. And we need to remember that over the last 10 years, the improvements in anaesthesia have been dramatic. And patients often have misunderstandings about what the anaesthetic involves, and often they have fears from previous experiences that we need to address. Then the next step is the hospital admission. And we work at several hospitals depending on patient requirements. Some patients need intensive care facilities or at least availability, but the majority of patients are well when they start the surgical process. And for those patients, we need a hospital where the infection rate is minimal. And for that to be achieved, generally we would choose a hospital without intensive care facilities because sick patients would not be admitted to that area. Then the surgical process is completed and patients are often discharged a day or two after the surgery, as long as they're happy to go home, they're mobile, they feel well in themselves.
Please visit us on www.jointreconstruction.com or call us on 9387 2877.